Pharmacy Skills Lab Communication Assessment. The actor in this video is a real student who was following a script. The following depiction does not reflect the student's actual communication skills.
Hi, I'm wondering if you can help me pick out something for my daughter for diarrhea.
Oh, certainly. So it's for your daughter, you said?
Yep.
Just to check, is it something you've seen a doctor about? Is it that bad?
No, it just started today, so I thought I would just talk to you and see if I needed to use anything or if there is anything I can give her.
Definitely. So you say it just started today. Can you tell me about the situation, what's going on?
Well, she woke up this morning and so, kind of normal time around 8, and then she's had 3 loose stools since then, and she was fine last night. Yeah.
Okay. So it just started today, about 3 loose stools that you've seen so far. Just to check, how old is your daughter?
She's 3.
Okay.
Yeah.
So I'm going to ask you some questions here just to make sure that I get you a safe recommendation that's going to work for you. Is that going to be okay?
Yep. That'd be good.
Have you tried anything for her yet?
No, we didn't really have anything to try. I wasn't sure what to give her. Yeah.
Okay, for sure.
Yeah.
And just to check, does she have a fever that you've noticed at all?
No, I did take her temperature and it was normal.
Okay, good,
Yeah.
good. And then, again, not to worry you, but just to check and make sure, is there any blood or mucus in the stool that you've noticed?
No, there's not.
Okay.
Yeah.
And does she seem to be dehydrated that you've noticed? So things you could look for there would be if she is having any tears, like if she's still producing them or if she's still urinating.
She's still going to the bathroom. Her lips are maybe a little bit dry, and I've been giving her water through the day. She seems like she's thirsty, maybe a little thirstier than normal.
Okay.
Yeah.
So a couple questions just to make sure that that we get you the right product here. Is she on any medications right now?
No, she's not.
So then, do you give her any medications that are over the counter, ones you can buy just in the pharmacy area there?
The only thing we give her is vitamins.
Vitamins?
Yeah.
Okay. And then just to check, are there any herbal products or natural products that you give her?
No.
Okay. Does she have any allergies that you know of?
Not that I know of.
And just to check, other than the diarrhea that's coming up right now, does she have any medical conditions?
No, she's a healthy little kid. Yeah.
Okay. So at this point, I don't think you need to buy any products. I wouldn't give her anything to specifically stop the diarrhea, but
Okay.
I think the best way to go about it is going to be to try to keep her hydrated right now.
Okay.
There are some products you can buy for that, but you don't necessarily need to. So I'm going to ask, do you have apple juice at home?
I think so.
Okay, because that can work okay as a rehydration product. So if you give her the apple juice, but maybe cut it by about half with water, so half apple juice, half water in 1 cup there,
Oh, okay.
and give her that.
Okay.
I would, though, if the diarrhea doesn't stop within 2 days, so you said it started this morning?
Yeah, this morning when she got up.
Yeah, so if it doesn't stop from 2 days from then,
Okay.
or if it seems to be getting worse, or if you do start to notice dehydration, so the lack of tears, lack of urination, or if the skin, when you pinch it, if it doesn't go back down like that, that's also another sign.
Oh, okay.
Or if she develops a fever, I would go to the doctor and get double checked.
Okay.
Just make sure that there isn't something more serious going on there.
Okay, sure.
I guess overall, do you have any questions that come up with that?
No, I wanted to talk to somebody and see because I just wasn't sure what I should be doing about it. Yeah.
For sure, yeah. So just mostly at this point, just the rehydration, making sure she stays hydrated, and watching out for those other more severe symptoms I mentioned, like getting a fever or having it not go away.
Okay.
Okay.
Okay, thank you.
No problem. Thank you.
The feedback provided in this video is comprehensive. In many situations, it may not be feasible or practical to provide such comprehensive feedback to a learner. Assessors should aim to provide the most comprehensive feedback possible with the time available, focusing on the most important aspects of what went well and what should be improved. Let's take a look at the feedback that would have been provided to this student. Here's what went well. The student was clearly respectful, empathetic, and compassionate. The council was well organized but still conversational and not formulaic or checklisty. Empathy was displayed by listening and acknowledging the mother's concerns and reassuring her that her daughter was not seriously ill and did not require any treatment other than fluid to prevent dehydration. The student listened and responded appropriately to patient verbal and nonverbal cues. This was demonstrated by repeating back what the mother had said, maintaining excellent eye contact, and nodding regularly to show that he was listening to her. The student responded appropriately to the patient's verbal and nonverbal cues by recognizing that she may have been concerned about her daughter. The student gathered information effectively and efficiently through the use of open-ended and closed-ended questions. Open-ended questions were used at the beginning of the counsel to get a general idea of the case of diarrhea, and closed-ended questions were used to rule out red flags later on in the counsel. The student used suitable language, tone, and nonverbal cues for the context. The student matched the tone of the mother and used a serious and formal approach, which was very appropriate for a mother who was concerned about her sick child. Eye contact was maintained throughout the counsel, and the student used silence to his advantage by stopping to let the patient think about his questions and respond before asking another question. He maintained a good pace and volume throughout. The student's grammar, vocabulary, volume, speed, and the use of medical terms were all appropriate to the situation. The student's communication portrays an obvious rapport with the patient. The patient was soft-spoken and appeared slightly nervous or worried, and the student mirrored her tone nicely to establish rapport with the patient. The student ensured patient understanding and agreement prior to departure. This was demonstrated at the end of the interaction when the student reiterated the main points of the counsel and what to look out for if it was worsening, and he allowed her to ask questions. Here's what could have gone better. The student gathered information somewhat inefficiently at times. This was demonstrated through the use of a few double-barreled questions during the counsel, such as, is it something you've been to the doctor about? Is it that bad? And, does she seem to be dehydrated, such as not producing tears or urinating? The main concern with double-barreled questions is that some patients will only answer the second part of the question, leading to missed information or requiring the first question to be repeated. If the student had waited for the patient to respond to the question, does she seem to be dehydrated, before going into an explanation about the symptoms of dehydration, that may have changed the conversation. For example, if the mother had responded listing all the symptoms of dehydration using medical terminology, it would have changed how the student communicated with the patient from that point forward. Some of the student's verbal communication lacked confidence. This was displayed when discussing the recommended course of treatment. The student used the terminology, I think the best way to go about this is to keep her hydrated. Avoiding terms like I think can convey more confidence in the recommendation. Overall, the student conveyed confidence. There was just one instance where this occurred. This is a small point, but the student very frequently warned the patient prior to asking a question by saying, I just need to ask about XYZ just to make sure this is going to be safe, or he kept saying, just to check, before asking a question. This is an extremely useful thing to do at the start of an interaction like this, or if you are asking an unusual or sensitive question, but it does not need to be restated over and over prior to asking every question of the patient. From the points discussed, this student conveyed very strong communication skills and was awarded a score of E, or exceptional. It is important to keep in mind that a student does not need to be perfect to award a score of exceptional, because perfection is not a realistic expectation. Students can still achieve E while receiving constructive feedback on how to improve. An exceptional score simply conveys a message to the student that the communication skills were demonstrated at a level that were above what would be expected of a typical practicing pharmacist, even if there were minor aspects that could have been better.